Gentlemen, if you're over 60 and want to significantly enhance your erectile strength and overall male vitality, pay close attention. As a urologist, I'm going to share a simple 3-minute daily exercise that can genuinely help you regain confidence and vigor. This isn't about shortcuts or miracle supplements. It's a method backed by real science. So stay tuned. On Men's Health Channel, we're diving into how you can optimize your intimate health for the long term. Welcome back. Throughout my career as a urologist, I've seen that a man's confidence is closely tied to his overall health, and sexual wellness is a key component. It's normal to experience changes in erectile function as we age. And let's face it, many men feel frustration or even embarrassment when these shifts occur. But I want you to know, you're far from alone. There are practical, effective steps you can take. Factors like blood pressure, diabetes, heart health, stress, and even some medications can heavily influence erectile function. It's a complex interaction involving your vascular system, and today I want to introduce a core aspect of male pelvic health that's often overlooked: the pelvic floor muscles. Think of them as the silent champions supporting your bladder, bowel, and yes, your erectile function. Strengthening these muscles with simple, targeted exercises can dramatically improve blood flow, nerve activity, and overall erectile performance. This isn't about increasing size, which exercise can't achieve, but about optimizing the health and efficiency of the systems you already have. So let's jump in. The exercise I'm referring to is widely known as the Kegel exercise. Traditionally associated with women, particularly postpartum, men can't underestimate their importance for our health. They play a key role in urinary control, prostate health, and as we're focusing on today, erectile strength. The first step is learning to identify these muscles correctly. This is critical. If you engage the wrong muscles, you won't see results. It's simpler than it seems. Imagine trying to stop urine midstream or preventing a fart. The muscles you tighten and lift in that moment are your pelvic floor muscles, stretching from your pubic bone to your tailbone. A common mistake is to avoid tensing your abs, thighs, or buttocks. That won't work. Instead, focus on a subtle internal lift, a gentle upward squeeze. You can practice this sitting, lying down, or even standing. Once you can feel the right muscles and are confident you're isolating them, it's time to begin. The 3-minute daily routine is all about consistency. It's designed to be quick, simple to fit into your day, and remarkably effective. Aim for 3 minutes each day. You can do it at your desk, in the car, or while watching TV. The secret is regularity. Like any muscle, your pelvic floor strengthens with consistent training. Step 1 is the slow hold, 1 minute. Start with what I call the slow hold. Gently contract your pelvic floor, lifting the muscles upward. Hold the squeeze for 3 to 5 seconds. Really focus on that feeling. Then, and this is crucial, relax fully for the same amount of time. Don't rush the release. Full relaxation is just as important as the contraction for blood flow and recovery. Repeat 10 to 12 times. This builds endurance and control. Step 2 is the quick flick, 1 minute. Now we move to the quick flick. This focuses on speed and responsiveness. Rapidly contract and release your pelvic floor muscles like a quick flutter or a light switch turning on and off. Do this for about a minute, emphasizing rapid contractions and full releases. This sharpens reflexes needed for strong erections. Step 3 is the endurance hold, 1 minute. Lastly, the endurance hold. This builds stamina for longer-lasting function. Contract your pelvic floor and hold as long as comfortably possible without holding your breath. Start with 10 to 15 seconds and increase gradually. Fully relax afterward and repeat 3 to 4 times. This step strengthens the muscles for sustained performance. That's it, 3 minutes a day. Simple, yes, but its effectiveness comes from correct technique and regular practice. Now, let's explore why this works. How does it improve erectile strength and male vitality? It's all about optimizing blood flow, nerve function, and venous occlusion. When your pelvic floor muscles, especially the bulbocavernosus and ischiocavernosus, are strong and toned, they act like an efficient pump. During an erection, blood fills the spongy tissues of the penis. To achieve a firm erection, This blood needs to be retained, and your pelvic floor muscles play a key role by compressing the veins that allow blood to exit. This process, called venous occlusion, is vital for maintaining both firmness and duration. A stronger pelvic floor creates a more effective blood trap, resulting in improved rigidity and the ability to sustain an erection longer. Think of it like reinforcing the foundation of a house. Everything above it performs better and more stably. Beyond this, these exercises also enhance nerve sensitivity and coordination in the pelvic region. Consider it fine-tuning a high-precision instrument. Better nerve function leads to heightened sensation, improved control, and a more responsive, robust erection when needed. This translates not only into firmness but also into enhanced climax and overall sexual satisfaction. While these exercises won't increase anatomical size, the improved blood flow, enhanced rigidity, and greater control contribute to a fuller, more optimal erection, one that feels substantial and performs reliably. It's about maximizing what nature has already given you by keeping these critical systems in peak condition. The benefits extend further. Strong pelvic floor muscles support bladder control, helping reduce dribbling or urgency issues, and can even improve premature ejaculation by giving you greater control over timing. In short, it's a holistic boost to male health and well-being. But while the exercises are straightforward, there are common mistakes that can reduce their effectiveness or cause strain. Mistake 1. Bearing down. Don't push downward, you want to lift and squeeze upward. Pushing down can weaken the muscles or create other problems. Mistake 2. Holding your breath. Maintain natural, steady breathing throughout. Holding your breath increases abdominal pressure, which is counterproductive. Mistake 3. Engaging the wrong muscles. Focus only on the pelvic floor. Avoid tensing your abs, glutes, buttocks, or thighs. If you feel these muscles working, you're doing it incorrectly. This exercise is all about proper isolation. Mistake 4. Overdoing it. More isn't always better, especially when you're starting out. Stick to the 3-minute daily routine. Overtraining can lead to muscle fatigue or soreness. And finally, an essential, non-negotiable point. While Kegels are highly effective and an excellent tool for preventative and supportive health, they aren't a cure-all for every issue. If you're experiencing persistent erectile difficulties, severe urinary problems, pain during erections, or any pelvic discomfort, it's critical to consult your doctor or a urologist right away. There may be underlying conditions such as heart disease, diabetes, nerve damage, hormonal imbalances, or prostate concerns that require professional care. Trying to self-treat these conditions can be risky. Early diagnosis and treatment are always the best path to long-term health. Don't hesitate to seek expert guidance. Gentlemen, taking charge of your health, even aspects we don't often discuss, is a true sign of strength and self-respect. This 3-minute daily routine is a simple yet remarkably powerful way to support your long-term erectile strength, vitality, and overall wellness. It lays a foundation for better health habits, boosting your confidence and improving intimate relationships. Remember, these exercises are most effective when part of a holistic approach. Pair them with a balanced diet, regular cardiovascular exercise, adequate sleep, and stress management practices. Think of it as giving your body every tool it needs to perform at its peak. If today's discussion has inspired you and you're ready to take further proactive steps for men's health, here's how to keep the momentum going. Hit the like button now. Subscribe to Men's Health channel and turn on notifications so you never miss practical, science-backed tips specifically designed for men over 60. Drop your questions or comments below, I read every single one, and your insights often spark future videos. What other men's health topics would you like me to cover? Thank you for watching. In my next video, we'll tackle another crucial topic: prostate health, when to get screened and why it matters. We'll cover the latest guidelines, common misconceptions, and everything every man should know to protect his prostate. You won't want to miss it. Stay informed, stay healthy, and keep taking charge of your well-being. We look forward to seeing you in the next video.